Hi, my name is Juliette Kumar. I am the Associate Director for Improvement and Education at the Innovation Agency, which is one of the academic health science networks in England. So hi to all my fellow Q members, and thanks for taking the time to listen about the proposal that I've put forward for a Q exchange. So very simply, this is a proposal about improving the well-being and resilience of frontline staff during the pandemic, which is taken from some of the learning that we've had over the last 6 months and some of the partnership working that we've been doing. So there's three things I really want this project to achieve. Number one is to capture some stories from frontline staffs about some of the initiatives that they've led to improve workforce well-being and resilience during COVID. I also want to insights piece, which brings together all the capabilities that are out there in terms of digital applications and online tools that can be pulled into one easy to access place so that individuals and organizations can have a look at them and make a decision of whether or not they would be something worthwhile to adopt. And number three is to create a cohort of wellbeing coaches from people within Cheshire and Merseyside. So we're going to develop a accredited coach training program. We have the capabilities within the Innovation Agency. We're going to tailor that to wellbeing coaching, and we're going to deliver it to up to 12 people within the Northwest, within Cheshire and Merseyside. So they will be sourced from a pool of clinicians and managers from our region, and we're going to see what the impact of those people will have in organisations over the next 12 months. So those are the three things. That's capturing stories, developing an innovations insights piece, and training wellbeing coaches for people out there. So why is this important to me? I have been involved in a digital action learning set over the last 6 months since COVID started, really. The digital action learning sets were set up by the Clinical Leaders Network, led by Dr. Andy Coley, and funded through NHS England. And they pulled together a paper that looked at the evidence-based approaches, but also the anticipated outcomes from the pandemic in terms on the mental health and well-being of our workplace. So we know that they are working under extreme pressure. We know that they're worried for their families. We know that they are being put in danger in front of a disease that is that can make them really unwell. So there's a lot of anxiety and fear in our system at the moment, and the paper was really set out what we need to be thinking of now in order to look after people who may be presenting with increased anxiety, with depression, and possibly even PTSD in our workplaces. And if we don't address this now, we will not have a resilient, and we will not have a workforce to continue the work that we need, the services that we need. And we know that if we get some great wellbeing, self-care, promote self-care in our organisations, we can prevent some of this happening, and we can also help people manage when they are feeling that they need support. So this project is really about developing some of those, a toolkit for this, and some wellbeing coaches. So I'm really excited about this project. I think that it's doable. I think we've got the capabilities within our innovation agency to manage this project. And also we have access to the Clinical Leaders Network, so we can capture some of those stories. So thank you for listening. Lots of detail in my online application. But if you do want to have a chat about this, then contact me via the Q website, or you can email me juliette.kumar@innovationagency.nwc.nhs.uk. So thanks for listening.